Thank you for joining us at Jones Advisory Group. My name is Josh Wyatt. I'm one of your Medicare advisors here to help navigate the Medicare maze. So we're going to go over a quick presentation today. It takes a little around 20 minutes or so, and we'll kind of dive in and help you with number one, education. What are my options with Medicare? What is Medicare? We're going to talk about that today. Number two, what are your specific options for you? What's the plans that best fit your needs? What are the costs? And then really step three is put a game plan in action to make sure that we enroll at the right times. Two quick disclosures here. I am not licensed with or employed by the government, the federal government, nor am I employed by Medicare. But I am licensed with the state of Kansas when it comes to health and life with Kansas and Missouri. So one quick disclosures there. So today we're going to talk about 5 things really. We're going to talk about Medicare basics, Medicare supplements, Medicare Advantage plans. We're also going to talk about prescription drug plans and important dates and more. So that's kind of our talking today. So as we look at healthcare costs in retirement, it's very concerning. Actually, in 2028, it's projected to hit $6.2 trillion total cost. Projected increase is about 5.4%, and I would argue that's even higher in 2022's inflation environment. So that's something that's very concerning. We want to make sure that we have a good game plan to cover healthcare costs. Now, looking historically, looking at the cost that has a dramatic impact on your retirement. So as we look at premiums for family insurance, it's increased about 47% over the last 20 years. Inflation historically has been in the 2 to 3% range, but gosh, again, recently we're looking at inflation in the 6 to 8% range, depending on what metrics you look at. So inflation and cost of health insurance costs will continue to increase in the near future. So how do we plan for that? Well, actually, seniors spend more money in healthcare than they have ever in history. So we look at spending for all ages, annual percentage is about 8.4%. But as we get older in the 65 and older range, typically the annual budget's about almost 14% of your budget is going towards healthcare costs. Typically your actual income total spendings decrease, but also towards higher on the healthcare cost. So what is Medicare? Well, Medicare covers over 63 million Americans. It is the largest program by the United States government to help cover healthcare costs. It's also administered and ran by the Center of Medicare and Medicaid Services, or called CMS. Now there's divided into 3 different parts. You have your Part A and B, which is also called Original Medicare, your Part C, which is called Medicare Advantage Plan, and Part D, which is Prescription Drug Plans. So we'll go over that. Easy, right? A, B, C, D. Simple. Well, let's talk about them in detail. The original Medicare is also offered by the federal government. Think of them as they're paying the bills. But you've also paid into the program for all the years you've worked. Now, looking at Part A coverage, you're going to have your hospital coverage. We're going to have your skilled nursing, hospice care, and also home health care. That's covered under section or Part A in Medicare. Now, Part B covers your outpatients or doctor's appointments, outpatient care, occupational, physical, and therapies, if you will. Now, as we look at Medicare coverage for Part C and D, those are actually administered by private insurance companies. They're a little bit different. So I would compare this more of apples and oranges and maybe bananas compared to as you compare different coverages. The Medicare Advantage Plan, also known as Part C, mirrors Part A and B coverage, but it may also include things like dental or vision, hearing possibly, or wellness programs. Your Part D covers prescription drugs. So think of it as anytime I use my card at the pharmacist and I get my prescription drugs filled at the pharmacy, it's covered typically under Part D, as in drugs. So who's eligible for Medicare? Most individuals are eligible when they hit 65, and then you're typically eligible for Part A and B, even if you're still working. Or if you happen to be on a disability program, it doesn't matter your age, but you're on disability for over 2 years, you may be eligible for Medicare also. Now, a lot of times people throw this card away. So if you receive your Medicare card in the mail, it has your name on it and your nice character digits there, and this number corresponds with your birthday. make sure you keep that card. A lot of people actually throw that card away. But typically you're automatically enrolled if you are receiving Social Security benefits and you hit 65, or if your railroad retirement benefits, you're receiving those. Those are typically on automatic programs. Otherwise, you have to go through a period of it actually enrolling. Now, the enrollment period is typically 3 months before you turn 65. That is a good window that you can enroll in Medicare, and that also includes your Medicare card. So it gives you kind of an automatic enrollment options here. So when is your initial enrollment period, called IEP? So in the three months prior to turning 65, you can have the initial enrollment period that gives you that window, the month that you turn 65, and 3 months after. This 7-month window helps you avoid a penalty and also gives you that eligibility. We definitely want to make sure that we are in that window, and if not, there are some other options too. Now let's look at original Medicare and your cost sharing. So as we look at original Medicare, if you've worked over 10 years or 40 quarters, you've paid into this program, typically for most people, it's $0 premium. However, there is a deductible. When you go into the hospitals, it's about $15.56 per benefit period. So there is a deductible, but we're not done there. There's also some copays. If you go in the hospital the first 60 days, it's covered 100% by Medicare. And then if you go into from 61 to 90 days, there's a copay of $389 a day. And then 91 through 150 days, you have a $778 copay a day. And then after 150 days, and I hope that you're never in the hospital for 150 days, then you have 100% responsibility. Skilled nursing, the first 20 days you pay $0. After the 21st days or 3 weeks to 100 days, you're paying $194.50 a day. After the 100-day mark, it's your responsibility at 100%. And that's how original Medicare Part A is covered at the hospitals. Most people are shocked. They thought Medicare would pay 100% of their healthcare costs, and actually it does not. Now your Part B costs will vary. It depends on your earnings, but most pay currently $170.10 a month. If you make more money, you would pay more. And we'll talk about that in a little bit. There is a deductible of $233 per year per person. And then also the big copay that we want to watch out for is Medicare pays the first 80% of that doctor bill or that surgery. And then ultimately after that, there's a 20% copay, and that's uncapped, folks. So if you have a $20,000 or a $50,000 surgery, you potentially could have a $10,000 copay bill that you have to pay to the doctor or surgeon. So don't worry, we have ways to help cover those costs. So think of this as original Medicare. This is how original Medicare was designed to cover a majority of your cost, but not all of it. So let's talk about that. This is called IRMA. This is based on the more you make, or the more you spend, or the more you take out of your retirement accounts, you could potentially pay more for Part B premiums. I would say 90+% pay the 170/10, but in the event that you take out more from your retirement funds or you earned more, you could potentially pay more. And here's kind of a grid here. So let's say, for instance, someone takes out extra because they wanted to buy an RV, or they wanted to pay off the mortgage. That's a good strategy. However, we want to watch out for potentially higher costs for up to 2 years as they look back at your history there. So we'll double check and I'll navigate that. But just think, if I make more, I pay more in the Medicare world. Also on prescription drugs, Part D, you would also have a premium or a penalty also. So that's something, if you fall into any of these categories, give me a call. We can talk about strategies to help reduce your overall payment, or maybe take out less per year to help stay within these thresholds. Now, there's a fork in the road. There's a left or right. The left side of the road is your original Medicare and a Medicare supplement world. We'll talk about that in a moment with private insurance companies. And then your prescription drug side is a standalone product too. So remember, prescription drugs to help for your pharmacy drugs. Or the other right side of the fork in the road, you have a Medicare Advantage plan that may include those additional benefits like dental and vision, which Medicare doesn't cover, and maybe a wellness program, and Part D. You can't have both. We can't interchange these two pieces. You either have the left or the right. Give you a quick story. My father is on the left side, which is a supplement world, Plan G, and my mother has the Medicare Advantage plan. And for the last 5 years, I've just heard them back and forth at the dinner table. Well, I'm right, you're wrong, and vice versa. So it's really fascinating. If you have a question or concern, I can definitely help you because I've had those conversations over the dinner table many times. Okay, so let's focus on the Medicare supplement world first. What I like about this world is it's comparing apples to apples. Medicare did a good job. They made it all the same. So whether you go with the blue company or the red company or the purple company, a Medicare supplement is exactly the same product standardized. So what does it mean? A Medicare supplement is administered by private insurance companies, and what I like about it is, and we'll go over that next, is it helps pay off the offset, the copays, which we'll go over in a moment. It covers copays, coinsurance, and potentially some yearly deductibles. Gosh, there's a lot of options. As you can see, there's Plan A through Plan N, and even Plan C. Plan F, if you're grandfathered in, Plan F, it's no longer available for new people. But again, looking at all these options, I'm going to give you a shortcut, right? We're going to navigate the Medicare maze. So here's a shortcut. The best plan in the Medicare supplement world right now, the Cadillac plan, the most comprehensive plan, is Plan G. It's going to pick up 100% of all those additional copays and coinsurances, except for one piece. That Part B deductible was blank here, which is, as a reminder, is $233. That's your copay to the doctor, or excuse me, deductible for the doctor. And then the rest will be covered by the Medicare Supplement Plan G. We'll look at that in a moment. Now, Plan N, what's the difference, Josh? Well, we look at this thing called Part B excess charges, 100% versus nothing. What is an excess charge? Medicare allows the doctor to charge up to 15% of what is allowed. So let's say, for instance, the doctor is able to charge $1,000 for that service. Then they can charge up to $150 more, and then they have to write off the rest. So that's what excess charges means. Even if you travel internationally and it's an emergency travel, they'll cover up to 80% of your healthcare costs in the emergency room if it's an emergency. So Plan G, think of that as a Cadillac plan and the Medicare Advantage plan. And what I love about a Plan G is it's standardized. It's the same no matter, gosh, there's probably 60 different options in Kansas for you. All the companies of Plan G is exactly the same coverage. Very easy to compare apples to apples. So how does that work? Basically, it's going to take care of this cost. It's going to knock out all those costs there and then take care of the big 20%. And after all those are taken care of, the only thing you have to pay is, of course, the monthly premium to have a Plan G plus the $233 per year as the Part B deductible. Now let's talk about special enrollment periods. So the first open enrollment period is typically starts at the first 6 months when you're effective. So when you turn on your Part D, or B as in boy, your hospital coverage, your doctor's coverage, sorry, you're going to look at 6 months, and now you're guaranteed issue. Regardless of your health status, they can't deny you. So that's a really important window that we want to make sure that we plan for and make sure we hit that goal, because it doesn't matter your health history, whatever plan you jump on has to take you, which is great. Special enrollment period, what does that mean? Those still guarantee you a right. If you pay to play, you jump on the plan. Now that might be an example would be someone that's retiring at 67. I'm on my group plan this whole time, but I did not turn on Medicare, and I decided to wait till 67, or I did turn on my Medicare, but I waited till 67. That's a window when I'm going to retire, where you can jump on, as long as you haven't had a gap in coverage. There are certain situations that you can jump on a plan and you're guaranteed. Don't have to answer healthcare questions, nor can you be denied, because it's guaranteed issue, which is a fancy way of saying you're guaranteed. The third option, which I want to, again, not necessarily avoid but prepare you for, is if we're outside of that enrollment period, typically you have to pass underwriting healthcare questions, so it's kind of a medical underwriting, and also there's no guaranteed issue. But don't worry, I've had people in their 80s switch plans because their health was reasonable, where they were able to pass the medical underwriting piece of it. So again, it just depends on your health history. But ideally, we want to plan on Medicare planning. We want to get you on the plan that best fits your needs up front. That way there's no surprises if your health does change. So let's talk about Medicare Advantage plan and how it helps cover the original Medicare. So I think of this as pay me now, pay me later. This is kind of pay me later. Typically with the Medicare Advantage plan, it is offered by private insurance companies. It's not standardized, so it's like comparing apples and oranges and bananas. It's all different, but I can help you navigate it. Also, you might get additional benefits that helps with copays and coinsurance. One of the things that my parents argue at the dinner table is networks. So usually with the Medicare Advantage plan, there are some level of networks. You either have an in-network or out-of-network. With my dad's plan, which is the Plan G, as long as the doctor accepts Medicare, there's no in or out of network. It would cover the rest of the bill. So there's some differences there. So what is a Medicare Advantage plan? As a reminder, it's going to mirror Part A and B coverage. It's going to mirror just like original Medicare. And then it may include prescription drug coverage. It might include dental and vision, which is not covered by original Medicare, and then a prescription drug plan. So it's all kind of a nice little package with a bow. Now, let's talk about important dates. Open enrollment, or an annual election period, I should say, is during October 15th through December 7th. That gives us a window to switch out of a Medicare Advantage plan or switch out of a prescription drug plan. That's a really important window to understand, because every year you want to most likely evaluate your options, and that's why you're here. Evaluate your options, what are my costs, and then you may switch for an effective date January 1st of the next year. And then January 1st through March 31st, if you're unhappy with your Medicare Advantage plan, that's an annual disenrollment period, you can choose to go back to the original Medicare. So it gives you another window to switch gears. Now let's compare and contrast a Medicare supplement versus a Medicare Advantage plan. As I mentioned, there's a fork in the road. You can't have both. You can have one or the other. So let's talk about the first one. This is kind of pay me now. Medicare monthly premiums. There's a premium, if you will. So that's pay me now or pay me later. Typically, there's a zero or low cost premium for Medicare Advantage plans. Prescription drugs and dental and vision, not typically covered. In the Medicare supplement, it's not covered, but usually it's covered in a Medicare Advantage plan. So again, benefits there. Copays to providers, no, there's no copays because it picks it up. And then yes, it might have a copay. You go to the doctor, it's another $25 a visit. A specialist, it's $50 a visit. There's additional copays typically in this world. Here's a big one that, again, pay me now or pay me later. The fourth one down, you could have up to a $10,000 out-of-pocket cost. So in the Medicare supplement world, there's no, because you pay a monthly cost. And then here, there could be up to $5,000, $7,500, or $10,000 on an annual basis for your copays or out-of-pocket costs. Do I need to go to a network of doctors? Typically, no. With the Medicare supplement, yes, in the Medicare Advantage plan. Usually you have an in and out network options. Then, can I appeal my decisions with Medicare? Yes, you can. With original Medicare and a supplement, yes, you can. Medicare Advantage plan, that is not an option. Can my plan drop my doctor? Nope, not in Medicare world or a supplement plan, but a Medicare Advantage plan, yes, they can change the network. They can drop your doctor. Can my plan be canceled? No, not in this world here, but yes, sometimes the Medicare Advantage plan, which is rare, they may leave the coverage area. They may say, you know what, we're no longer going to offer coverage in the state of Kansas or whatever state you're located in, and therefore you no longer have that option. So that could be a possibility. Very rare though. And then also if I travel international, is there coverage in the Plan G or supplement world? Yes, up to 80%. If it's an emergency, if it's not on the Medicare Advantage plan, no, it's not covered, but you can either get trip insurance or figure out a way to subsidize that when you're on your trip internationally. So choosing what's right for you. Again, going back to my mom and dad, my dad has a Plan G or a Medicare supplement world. My mom has a Medicare Advantage plan. I compare it to like a pair of shoes, right? You may say, hey, these shoes are a good fit, but it may not be a good fit for someone else. Another example is if you have a certain plan, we'll run three different scenarios. You have a Medicare Advantage plan as an example. You have a healthy person. They love it. It's great. I go once a year, I get my physical, everything's great. Low copays are very low cost for me. I love this plan. You might have a second person run through and they might need a surgery or two or just a little bit of health care coverage and they may not like the plan. Well, gosh, I have a high deductible. I went in for surgery and I had to pay $5,000 out of my pocket. It may not be a good fit for them. And the last person is more someone that's a diabetic. Ongoing medical needs, they may need more physicals, more tests, more labs, and potentially insulin, which can be very expensive on both plans, but it may not be the best fit for them. So it really depends on your health history, And oftentimes I do see, like my folks, divide and conquer. One person likes this plan versus the other, and it really depends on what fits your needs. So let's talk about prescription drug coverage. Prescription drugs, very simple. Any prescription drug that you get at a pharmacy is covered under prescription drugs. They have a really cool tool on Medicare.gov. We can shop the different 20 plus options here in our area, and ultimately it depends on your medications. The most expensive plan may not have the best coverage. It really depends on the prescription drugs that you're taking. I can help you navigate that. So there's two ways to elect to have prescription drug coverage, Part D. Some of this may be new or review for you. You can either do a standalone prescription drug plan, which is very easy to shop, or if you go to the Medicare Advantage world, you can also include prescription drugs. Again, you can't have both, you can have one or the other. Really cool tool here through Medicare.gov. Medicare.gov website, you type in your prescriptions and it kind of spits out, or the results tell us the data of what plan best fits your needs based on Medicare. But let's talk about prescription drug coverage. In the Medicare world, there's about 4 different tiers. Now, as we look at your initial coverage, which is $0 to $480, that's usually your typical kind of deductible, if you will. Now, if you're on a tier 1 or tier 2 drug, typically it doesn't apply to the deductible. We'll go into better details later, but let's just talk about the 4 phases. Phase 2 is usually $480 to $4,430. That's phase 2, where there's different type of coverage, really depending on what tier of drugs that you're taking. Now, there's also something called the coverage gap, or you may have heard of the donut hole. That's typically between $4,430 and $7,050 is a gap in coverage, where basically there's different coverages of your drugs. But once you hit the catastrophic coverage, which is over $7,050, then there's they cap kind of those costs. It's either 5% or either $3 or $4 or roughly under $10 for your prescriptions. Even if it's a $1,000 a month drug, once you hit that retail cost, they limit your overall copays. So we'll kind of go into details there as we kind of one-on-one as we talk a little bit more about your situation. Great resources I mentioned earlier. Medicare.gov is a great tool to utilize. I love it. And so I can definitely help you navigate that area. Medicare and You Handbook is a really good publication I recommend to check out, digital, or they used to mail it to you. And then ultimately a Medigap policies. We can go over all that during our one-on-one visit. So again, today you've been educated. Number 1, what are my options? Number 2 is to set up and schedule a visit with me. We'll sit down and show you all of your options on the table and then look at the cost. What's the best fit for you? And then number 3, we'll come up with the Medicare planning of when to turn it on, when to enroll, what are my options, and really timing. We want to make sure to put you in the first 2 windows where you're guaranteed issue, pay to play. You don't have to worry about being denied. I'm really glad that you have joined me today, and I look forward to the next step. Give our office a call. Let's schedule either a phone call or in person. Let's really map out your Medicare planning, and we do so much more. Health and wealth. I hope you guys have a great 2022. Thank you guys. Take care.